Yeah. Okay. Share stop for 5 minutes.
Good evening, everybody, and welcome to yet another episode of the ICOG Guru Mantra series, where we have stalwarts and legends of FOGSI and ICOG who are here as the invited speakers. It's a matter of great pride and privilege that this series has been running since several years now, and we've had several legendary figures who have been teachers of teachers for several years, who grace the occasion, and who are here to impart their knowledge, their experiences to all of us. Today, we have two distinguished stalwarts who are going to be speaking to us. Both of them have served FOGSI as well as ICOG in various different roles and capacities in the past. And without further ado, I will request Dr. Sheila Mane ma'am to please take over.
Hare Baba, I'm talking here. Hello. Right. Good afternoon and welcome. Facing some technical issues, so I've joined from my phone. First of all, I would like to thank Dr. Rohit Bhatt and Dr. Dilip Datta for accepting the invitation to grace the occasion. And I think all of us forward to hear the words of wisdom from both of you. As we know that in ICOG, now we have started working this year. And if we look back at the ICOG history, I think ICOG is strengthened by all of you for making it more powerful by your ideas as well as the dedication which all the seniors have shown over a period of time. So I really feel privileged today to have both of you here. My pranam to you. And this is a Guru Mantra program. And I think I'm really going to Guru's blessings today. And thank you for all those who have joined today's program. So thank you. And over to you, Pratik.
Thank you, Dr. Sheila Mane, ma'am. And we are delighted to have with us as chairpersons two very important people who have graced the occasion. We have with us Dr. Parag Biniwale, sir, who is the immediate past chairperson of ICOG. Parag is also well known to all of us as the past president of Pune OB-GYN Society. He has risen through the ranks. I remember I actually came into ICOG because I was inspired by the work that he did as the secretary of ICOG a long time ago. And he is somebody who we all look up to after a very successful tenure as the chairperson of ICOG. Can I request Dr. Parag Biniwale, sir, to introduce the legendary stalwart, Professor Rohit Bhatt?
Thank you, Pratik. Good afternoon. It's indeed a pleasure to be back at the ICOG Guru Mantra. So thank you, Chairperson Dr. Sheila Mane, Sadhana Gupta, and of course, Pratik, who's a hardworking secretary, for having me here. And thank you for asking me to introduce somebody who I have adored for the last 25 years, Dr. Rohit Bhatt. Sir, I vividly remember my first interaction with you when I was a very, very young secretary of the Pune OB-GYN Society, and you were the vice chairperson of ICOG then, way back in 2002. And all I have received from you is a lot of affection, love, and encouragement. Dr. Rohit Bhatt, for those who haven't seen him in action, is Chief Department of OB-GYN at BD Amin General Hospitals. He's been a past president of FOGSI, NARCHI, and ISOPAR. And of course, he's been the chairman of ICOG from the year 2003 to 2005. And I was witness when he was installed as the chairman in the year 2003 in Bangalore. We were happy to confer the Lifetime Achievement Award in January 2026 from ICOG for his great contribution to the organization, right from its inception to the whatever we are here today. Sir, it's indeed our fortune to have you with us, and I'm so happy that you will be deliberating on the progress of ICOG so far. Thank you.
Ma'am, Bhaskar sir also joined.
So, welcome, Dr. Bhaskar. and president of FOGSI, and it's my
No,
I
Sheila,
think
it's just okay. Don't interrupt things. I think
Okay.
it's my pleasure and honor to be here when we have we have the iconic Professor Rohit Bhatt and our dear senior Dr. Dilip Datta here giving messages to our younger members. So, um, excellent. Please keep it up. And I'm just here. Thank you.
Thank you, Dr. Bhaskar.
Chair, please share the PPT of Rohit Bhatt, sir.
Yes, ma'am.
Sir, please go ahead.
Am I audible?
Yes, sir. Please go ahead. Sure. First,
Thank you, Dr. Shilaji, Sandhya Dr. Pratik, and Parag Beniwale, my great friend. It's an honor and a privilege to be invited to give Guru Mantra. Actually, I feel that a good teacher is one who remains a lifelong student. The day you cease to be a student, you cannot be a successful teacher. Next. Can I have next slide? ICOG is a brainchild of Dr. C.L. Javeri. He conceived this thought for a long time when he visited other countries where they had the colleges of OBGYN, because India had a FOGSI. So he thought that why not we should have a college also. Many seniors that time felt that we already have a federation and there's no need to have a college. Now this is a problem what we find, because most of the countries in the West, they started with a college and they didn't have the federation as we have. We started our things with a federation, and that's why there is always a difficulty in amalgamating. But fortunately for us, ICOG and FOGSI are running very well together. Next. Can I have next slide? Javeri, since he was the architect of Indian College of Obstetrics and Gynecology, he was the first chairperson of the Indian College. Rules to become a fellow were very strict, and we had only 80 to 100 fellows initially for the few years. Another slide. Next slide. Now, from initial 80 to 100, we have 2,500 plus fellows. We also hold membership examination. ISOG from a small seed has boomed into a grand banyan tree in the 40 years. Next. Aims and objectives are known, but I would like to promote education, training, research, spread of knowledge in the field of obstetrics, gynecology, reproductive health, family welfare, and related areas. Next, vision, to strive for advancement of standards of education and quality healthcare practices throughout India, to encourage safe and ethical obstetrical and gynecological practice for patient benefit. I feel that SOG is not only responsible for the health of the women we treat, but also I would suggest that we must add one more objective, to look after the health of the members of ICOG. So many of our members suffer from some psychosocial issues. There's an increase in incidence of depression, anxiety, obesity, and risk of suicide. I think I will request the chairman to think of ICOG should have a cell to help our members in such cases. CMEs on such subject issues may be useful. I thought that health of the members is also equally important for ICOG program. I hope Sailaji has taken note of this one. Initially, there were very small beginning, very few academic programs, but planning continued. Gradually, there was marked increase in academic programs. Interest in incoming ICOG among FOGSians increased. Now we have 2,500 plus fellows. A lot of academic activities, seminars, conferences, webinars, etc. are held regularly. Next. As ICG fellows, we must keep open mind to discover new ideas, innovation, and exchange of thoughts. It is aptly described by Rigveda. Next. Ano Bhadra Kartavo Yanta Vishwataha. In a famous Vedic mantra from Rigveda, it says, may noble thoughts come to us from all directions, symbolizing universal acceptance, openness to knowledge from everywhere, and pursuit of wisdom beyond boundaries. I thought we must learn from Rigveda what we can do. Another thing is, then we are always restless about things. Lord Krishna said in Bhagavad Gita, Lord, O mighty arm, son of Kunti, it is undoubtedly very difficult to curb restless mind, but it is possible by suitable practice and be detached by detachment. So that is what we require in ICA Marwar fellows. Sometimes to become restless, that's very important. It takes 2 years to learn to speak and 60 to learn to keep quiet. This is very important, unless you say like that. But so very often, sometimes it is wise to remain quiet and listen to others. Next. Now, this is very important for us ICOG members. How we think and how the patient thinks. When we are taking the history, we expect them to tell us in the straight line as we see in the top. But the patients are saying that way in which so critical that it is difficult for us to grasp what the patient is saying. And this is where real taste of our knowledge comes as doctors when we truly take history of our patients. Next. Life has 3 X factors. Yesterday was experience, today is experiment, tomorrow is expectation. Use of experience in your experiment to achieve your expectation. That is what happens, that we hope in ICOG. We start from experience, then go to experiment, and finally we go into expectation. Next. What is the secret of healthy living for ICOG? I remember a Tibetan proverb. It says, eat half, walk double, laugh treble, and love without measure. So there is an ICOG family that we must remember, that we must love each other with great respect for each other. That is why Tibetan proverb is very important. This is important for us to remember when we say about research. I'm sorry to say, but this is a fact of life. An important scientific study proves that the result of a scientific study depends entirely on where the fundings come from. It is important that when we accept a lot of grants from other pharma companies, sometimes we get bound to appreciate and talk highly about their products. But modern research should not depend on the guidelines of a pharma company. We are independent members. We should not be guided by pharma company. We should work in collaboration, right? But should not be sold to the company. This is what we find sometimes, that we are overzealous to support a product which we do not know whether it's good or bad. Next one. Now, this is very important. We find always people will say studies have shown that people will believe in anything that starts with these words. Studies have shown. If you say studies have shown, people say, oh yes, it must be very scientific. But this is not correct. Very often we just try to quote studies which are not very scientific or proved ones. Next one. Intelligence might get artificial, but stupidity will always be natural. So that's, we must remember that at present we are talking a lot of artificial intelligence, but we do not know what is the fate in the long term. At present, we do not know whether it's good or bad, how it will impact our ICOG and healthcare facilities so far as artificial intelligence is concerned. But I'm sure that it's not end to stupidity, will always remain natural. Next. Two biggest challenges that our world is facing is natural stupidity and artificial intelligence. So these two things we are fighting together. So I felt that since AI is now almost going to be part of our life in India as well as the rest of the world, we must use it very judiciously and carefully so that we are not guided in the wrong direction. Next. Next slide. Road to success. This is very important. I must remember our ICOG members. What is the road to success? As we said in Sanskrit, jignasa or curiosity, dhairya or patience, leadership development, ekagrata or one-pointedness, faith in one's own possibilities, abilities, and purushartha, effort. That is most important, is purushartha, that we must remember. What is the road to success for ICOG members is this: follow these 5 important principles in life, so you will never fail if you follow this. Next. I requested my guru, tell me something about success and failure. He answered, success hugs you in private, and failure slams into public. When you become successful, people will come and ask you, how are you? And when you fail, the same people will say, who are you? He also said, जितनी इनकी तारीफ झूठी होती है, उतनी ही झूठी उनकी गालियां होती है. You just focus on your work, your goal, and your vision instead of guided by other views, because there will be always people who will talk in front of you, in favor of you, against you, but you must stick to your principles and wisdom. Next. Who are teachers? In English, we have only one word, teacher. We must know, unfortunately, we find Sanskrit is disappearing from the knowledge of the modern generation. And we were students, very special class and special examination in Sanskrit. Sanskrit is perhaps the only language that has such a refined vocabulary to distinguish the different types of teachers. For us, teacher is a teacher, but I will just tell you in brief what does Sanskrit says, what are the different types of teachers. Next. Many teachers, Sanskrit words for teacher based on their unique abilities. The teacher who gives you information is called Adhyapak. The teacher who imparts knowledge combined with information is called Upadhyay. The teacher who imparts skill is called Acharya. The teacher who is able to give you deep insight into the subject is called Pandit. The teacher who has a visionary view on a subject and teaches you to think that manner is called drashta. The teacher who is able to awaken wisdom in you, leading you from darkness to light, is called guru. And that's very important. This is the 6th point, I think, all must remember. The real guru is one who is able to awaken your wisdom in you, leading you from darkness to light. Sanskrit is perhaps the only language that has such a refined vocabulary to distinguish different types of teachers. I hope the ICOG members will remember these different definitions of teacher. Next one. What is a conference? The confusion of one man multiplied by the number of people present. And the conference room is a place where everybody talks, nobody listens, and everybody disagrees later on. So you must remember that this is what happens sometimes, that people are found when the lectures are going on, they are either busy with their smartphone or talking to the neighbor by the bedside, and hardly they listen. So this is how we have to be very, very careful about the conferences. Next one. 3 types of friendship. In ICOG, we must remember, if you say concept leaves are seasonal, they fall off. That is not a long-term friendship. Branches also may be cut, but our friendship should be the root of ICOG. Through thick and thin, we remain together. ICOG members, fellows, and members should remember that if we want to maintain friendship and together, we must be at the root, not only the leaves and branches. Next. The saddest aspect of life right now is that science gathers knowledge faster than society gathers wisdom. That is what Sir Isaac Asimov said. So we must remember that science and wisdom must go to hand in hand. Sometimes if the science goes so fast, like using the atom bomb, If there's no wisdom, we might use this knowledge or newer advantages or advances in the wrong fashion. So we feel that a good system is one where knowledge and wisdom go together. Otherwise, knowledge without wisdom is of no use. Next. Discussion is an exchange of thoughts and knowledge. Promote it. We must promote discussion. Argument is an exchange of ego and ignorance. Avoid it. We must avoid that. And that's very important that we must continue to discuss less about the argument when we meet in the different meetings, seminars, and workshops. Next one. Thank you. I hope to try to be good advice as a guru, what I see members must follow. And this is important. A good teacher should remain a lifelong student. And I wish to remain a student even at the age of 95. I feel that remaining a student is the first step to learning. Thank you very much all of you for inviting me. Thank you.
Thank you very much, sir, for joining us today. Each and every slide of your presentation is worth remembering because it is a life lesson that you've given us. So this was the sole purpose of having Guru Mantra, and we are really happy that you could be part of it and you could give us lessons which all of us would cherish all through our life. Thank you very much. Sadhna, you want to add something?
Thank you, sir. It was the essence of Guru, and rightly symbolize and personalize that Guru mantra. I hope that whosoever have listened and will be listening on the video recording, we will be not merely student, but we will be pure disciple, and finally the dedicated one. So our own philosophy also demarcates the different type of student. So it is not student to teacher, disciple to acharya and guru, and dedicated to the drashta. Very how you have presented the very agonizing and aggressive challenges which now medicine and the science have today, artificial intelligence, sponsored research, and aggressive marketing, and how the ICOG fellows and as a doctors who are actually blessed to serve the very heterogeneous population, right from very poor, very marginalized society. These are the challenges which we must be very much aware of. And in my journey in FOGSI, I've always looked forward to you, that how you look into the things and how you pick up the people, and how wisdom and your wisdom and the observation of the world has benefited our organization. It was really a treat, month from the Guru, and hope we will have all these wisdom in our day-to-day life when we are facing the working in the federation, working in the ICOG, and with our people. Thank you, sir. It was a real honor to listen to you.
Thank you very much.
Thank you, sir. I think, sir, my Guru Mantra program has achieved whatever it had to achieve today by your presence. I mean, a real Guru Mantra he has given you. I mean, the definition of teacher in Sanskrit, which you gave as Adhyapak, Upadhyay, Acharya, Pandit, Drashta, and Guru. I think you are a amalgamation of all, and we are so proud today to have you. My pranam. And I wish if I was in a hall, I would have given a standing ovation by all of us to you, sir. Okay. And I think I am going to have this recording, sir. And whenever possible in our ICOG programs, Dr. Parag and Dr. Sadhna, I think we must play this because it's a very great message today in such a short time you have given us. And we are really obliged to you. And thank you, sir. Thank you.
Thank you. Thank you.
These are the life lessons I think all of us need, and when it comes from somebody like Dr. Rohit Bhatt, it appeals really. It touches the heart. And sir, we are really grateful to you for spending your time. Not everyone at the age of 95 is so active, and we're really blessed to have you as our past chairperson and a guru today.
And
Thank you
best
very
as
much.
always. And I think me and Parag are very happy that we could honor you with Lifetime Achievement Award in
Absolutely.
ICOG function in Delhi. I think that was God gave us that opportunity for us actually. So that is nice. Dr. Pratik, you would like to say something?
Thank you very much, Professor Rohit. But sir, it's always wonderful to listen to you, your quirky sense of humor, the beautiful lessons that you convey in such a short time. I think these are lessons which one learns in the journey of life, and you've delivered them in such a short time. It's like a bolus dose for all of us. Thank you so much, sir, for being with us,
Thank you.
for sharing your thoughts and all the wisdom that you have gained over the years, over the decades. I hope we'll be able to emulate at least some of them and put them into practice. That will be the actual passing down of your teachings to our generation. Thank you so much, sir.
Thank you.
I think, Dr. Pratik, some of our governing council members have joined, and if they would like to say something. Yes,
Yeah, I can see
I can see
Dr.
Upama
Tarini is
Deepa.
there,
Anybody would like to say
Anita
something?
Rajoria.
Good evening, sir, and respected Rohit Bhatt, sir. It's really an honor today, sir, to listen to you, your journey. And, sir, we are blessed to have you with us. Thank you so much, sir.
Thank you. Thank you.
So if we can move
Okay,
with
yes.
your permission, ma'am, to the next
Yes, sir.
speaker.
Yes, sir. Thank you, sir.
So to introduce the next speaker, Professor Dilip Kumar Datta, I would like to introduce our Vice Chair of ICOG, Dr. Sadhana Gupta. She herself is a legendary stalwart in the field of obstetrics and gynecology, past Vice President of FOGSI. She is currently the Vice Chair of ICOG. She has served the women of India for decades together, written innumerable books on antenatal care, and she's somebody who we all look up to for guidance. Thank you very much, ma'am, for joining us and for agreeing to be the chairperson. And I request you to introduce Professor Dilip Kumar Datta.
Thank you, Pratik. And it is an honor to introduce Dr. Dilip Datta in ICOG Guru Mantra session. And his CV is flashing, very brief, author of 40 books, Vice President FOGSI 1999, Vice Chair ICOG 2013 and Chair ICOG 2015 with more than 500 scientific papers. And his research and the ground level work has been recognized internationally. And but beyond the all brief CV, there lies a person who has been committed, who has been vocal for the maternal health and hailing from a very small place that is Kalyani, close to Kolkata, and his determination and his non-fatigue and a constant work and the voice on the maternal morbidity and the criticality as well as the healthcare for the rural women. There is a long and a very deep and a turbulent journey for Dr. Dilip Datta, and it is great to listen from Dr. D.K. Datta on this Guru Mantra session in ICOG, and we warmly invite Dr. Dilip Datta for his deliberation.
I think I must share that he was been awarded in recent FIGO in Cape Town when he conducted a workshop on maternal mortality. And I think that was a real great honor that he really projected the real picture of India in that workshop. So that's a real honor. So we are honored to have you, Dr. Dilip Datta, today.
Has he logged out? You can't see him.
He was here just now. I saw him walking. He was
Yeah,
logged
but
in from
then
the phone. Maybe there's some network issues. We'll just wait for sir to rejoin.
Sir had joined.
Hello.
yeah,
Yes, sir, we can hear
there's
you.
Dattaji.
Yes. Some
Yes,
network
sir.
problem.
We have just introduced you,
Uh,
sir. If you would
yes.
like to go ahead.
Yes. Now, my first of all, my heartiest pranam to Rohit Bhatt sir, and also all my colleagues in the ICOG. As you know, my journey towards the maternal mortality is started in 1984-86 when I was a house surgeon in Shichar Medical College, where we have found that 4,000, please don't move now, okay? 4,000 per 1 lakh women die in Silchar, Assam due to abortion. In 1977 and 79, when I read the Medical College Guwahati, we found that here the death is 3,000 per 1 lakh due to anemia, hypertension, and PPH. In 1983, when I came to Calcutta, West Bengal, I worked in the PSC, where we find that so much death due to the PPH. In 1999, when I got the vice president post, I traveled all through the India. I found that Kerala and other states are doing very well than the Bimari state like UP and Bihar. And 2000 to 2005, when I was a chairman of the Save Mother Committee, we published many books to reduce the maternal death. I traveled all throughout the world, especially Japan Health Minister and WHO, to highlight how we are reducing the maternal death. And lastly, as a chairman of the ICOG, we have done the first World Congress on Why Mothers Die in Calcutta in association of BOGS. Next slide, please. So we know that there are many causes of PPA, of maternal death. One, due to the anemia, is very common. Then the septic abortion. Then we find that this hypertension, many things happens there. Because of lack of time, I'm going to only concentrate on postpartum hemorrhage. It is a leading cause of the maternal mortality globally. In low and middle income countries, where up to 25 to maternal deaths are caused by PPH. WHO analysis of 35,119 maternal deaths documented that whereas PPH is responsible for 13.3% of maternal mortality in the HIC countries. In Asia is 32.8%, in Africa 30%. More than 80% of maternal death from PPH occurs in sub-Saharan countries. Next. You know the causes mainly in the PPH is the uterine atony, placenta previa, trauma, injury, and the inversion of retained placenta. Next. We know the uterine may happen with a normal delivery and LUCS. Next. Next slide. This is, I have worked this one, the modified technique of normal vaginal delivery to prevent the third stage complication and compared study that was done in 2000. Next. You know the postpartum hemorrhage remains a vital cause until they work and abundance, everything happens there. So next one. Next slide. As they prevent the third stage complication, certain modification of existing normal delivery have been formulated by me, which is more convenient and safe, especially minimum facilities to check the obstetric emergencies are lacking. Next. You know, we make the group A, B, C. You see the group A, after delivery of the baby, is put on the mother's abdomen till the placental expulsion. Or a group B, after delivery of the baby, is put in the liver for till placental expulsion with misoprostol. And group C, baby is separated before the expulsion of the placenta. So this is we make it the group at that time of 2000, at least 25 years ago. Next slide. And you know, this is the quality of this one. Next one. You know, the comparative study of done group A, B, and C. We'll find that group A is better in ascending uterine contraction, placental expulsion, post for the hemorrhage loss, and retained placenta. Because why I have done this work, in the reality in the primary ulcer, I find that a lot of PPH is coming. So I made these techniques and I published in the journal during that time. That is 25 years before. Next. This is how you're teaching our PSC, that how you deliver the baby. Next. Then after delivery, next one, the put in the mother's abdomen. Then immediately put in the breast. This is a technique we have done it, and then to find what it was in at least 25 years before. Now, advantage of this one, I find that sustained uterine contraction at retraction probably due to fetal weight on the mother's abdomen, fetal movement, and the psychological changes. Next one. Next. So these are the advantage of this one. Next one. Normal temperature, baby, everything maintained. Baby can be easily put on the breast on early sucking. This is I adopted during that time and presented in the Washington World Congress in the poster presentation. Next one. The do not interfere, suitable technique to rural women in the Asian countries. Next one. Next. So in conclusion, I say that is a primary clinical study supporting the biochemical and this one. But this study clearly shows that placing the baby on the mother's abdomen after delivery till the expulsion of placenta never cut the cord at that time. Minimize the complication of third stage labor, especially in the lower resource setting. Next. Now, when uterine anatomy comes in the management of uterine during LUCS, by educating the scoring technique, a comparative study. Next one. And we know that after LUCS, if the problem arises of PPH, all these things come forward to prevent the maternal death. Next one. But my technique is very simple. It's a doctor scoring technique just by observation step. A third, which will require the shape, size, tone, rugosity like this. Next one. This is, I've done it in the 0, 1, 2, and you see it, shape, size, rugosity, tone, placenta expulsion. Accordingly, we make the 0, 1, 2. Next one. Then group A, 8 to 10 is better than the group C, less than 5, and group B, 5 to 7. Accordingly, next one. We give the medicine, which we put there. At that time, we are using these work done in 2006 to 2011. And we are at that time, we are using the methargine. But now we have changed it. So we have gone to these other drugs like temexingacin. Next one. So this is a techniques we adopt this one. That's the scoring. Next one. Then you find the group A. Next one. See, the uterus is nicely contracted. Next one. Everything is all right. Nothing require no drugs except you can give the oxytocin. Otherwise, it's okay. Next one. No problem is that. You just see his uterus contracted nicely. Next one. Then, after 2 hours, this is the patient's abdomen and all these things. So this scoring technique is the excellent one to me. Next one. Now in the group B, you find that we are repairing, they're closing the wound. Next one, we're giving the drugs. Next one. Next. Next. Say, nice, the contraction is coming. You're not too worried out of that one. Next one. Then put this one. Here you see the rugosity is less than the group A, but it's still better. Next one. Next. So in group C, this is important for us. You say we are giving all the drugs I told you, and then we are closing the wound, not to be worried. Next one. Next. Next. Now say after the closing the wound, collaterally, then anteroposterior compression, because if the blood may be clot there, because you close the wound, so your clot will go outside. Then is anteroposterior compression. Next one. Then you find the isthmus compression. Next one. Then put it in the abdomen, wait for 5 minutes, see the uterine contraction better or not, but still better than the previous one. Next one. Then you just see here wound is closing the wound. You find this still is better, but not in compared to group A and group B. Next one. So, and then see before transferring the patient, then not to worry. So in the group C, not to worry, not to jump for big lynch and other techniques. Immediately you see it, everything is okay. Next one. This is the things we have done it. This is some of the slide. Group A, B, and C. Next one. So this is, I've done the protocol of this, how to manage it accordingly protocol. My intention is very clear, sir. We want to prevention. Our women are very much anemic. They are comorbidity. So if we prevent it from the very beginning, we can stop the bleeding. If even that in group C, there's a problem arises after this protocol, then you can switch over to the techniques adopted like big lynch and other techniques. Next one. So conclusion, I said that at that time, that this enormous trial also highlighted the importance of group C is very important. Next one. This is published in 2011 in the ICOG journal. Next one. Then who this FIGO has invited me. We've been in technique in 2021 at the Australia, but due to the COVID, we have not went there. But with the Zoom, we have done it. Next one. There's a comparative study have been done. Next one. The recent study concept before that one, we have done every CN section before we are doing the CTBT platelet, all this sugar, oxytocin, prostaglandins. We are doing it now just before CN section. Next one. Then you are the statistics of PPH is coming all through the world, and then I am only for preventive measures for this one, but definitely neonates is also very important to prevent the PPH, because my intention is very clear how to prevent the PPH. Next one. Now, after that, we come to the placenta previa. Next one. The spectrum has come, pass, evaluate. I'm not going to details. Next one. This is abnormal. Next one. This is a placenta. There is lot of tops of now level 1, level 2 like this, or different category as by different one. But I concentrated this one because this is an anatomical bleeding. Anatomy is the biochemical and then physiological bleeding. But here this is anatomical bleeding. So we have to control this bleeding. Next one. This is a vasa previa. You have to exclude it. Next one. Under a good obstetrician experience. Next one. Then place how to do management. Next one. Then the problem we're facing, bladder, dilated vein, all these things. You have to be very careful for this one, especially for the young generation who are doing the operation there. Next one. Then as an ejection method, what they are doing, they deliver the baby first, then they try to remove the placenta, and then they will give the oxytocin and other drugs. And if bleeding is there, they are controlling it. Next one. That may lead to a lot of complication. Maternal mortality, morbidity is very much high. Next one. The FIGO also invited me on giving of this one. Next one. This is a FIGO 2023 in the Paris, where I was there. At that time, they are doing the hysterectomy, and they're showing the picture in the FIGO. They are doing everything in the hysterectomy, in the placenta previa and all this. Next one. This is a FIGO doing the hysterectomy. Next one. Now this year in Cape Town in FIGO, we have done how to reduce the maternal mortality. I got an excellent certification because we got done 3 and upwards session how I'm reducing the maternal mortality. It's a great achievement for me and for my team. Next one. And see how we are seeing the FIGO wall Congress. I'm showing it this time, the poster presentation. Next one. Now, what is my technique? Next one. This is 2013, I've done it. If you know the anatomy, next one. Next. Next one. Now you have to do the indwelling catheter properly to prevent the bladder injury. Next one. My technique is very simple. That after delivery of the baby, I ligate the both sided descending branch of uterine artery, and then both sided after ligation of this one, or you may ligate the uterine artery, and you give the temexicity, maybe the upper segment contracted, and then oxytocin dip. After that, you take the placenta. It is done in the case of placenta accreta. These techniques, I think, the placenta accreta. So since you take the baby, ligate the descending branch of the uterine artery, it is reducing the perfusion pressure, give the oxygen other drug to make the upper segment contracted, and then you take the placenta, you find the bleeding is less. If the bleeding less is there, you can control very nicely. Next one. The next one. Next one. This is where we're done it. We're ligating it. Now no bleeding is there. Baby is taken out. We are taking the placenta also. Less bleeding. Next one. This is some of the technique. So this is the technique. No bleeding is there. Already have ligated. Next one. So this is published in the 2013 in the Asian Journal of Medical Science, that how I adopted these techniques in 2013, the 12 years since now. So this is my intention, very clear: prevention of maternal death due to PPH due to placenta previa. These are for placenta accreta. Next one. Property study done. Next one. Then we find that you find it in the slides. Good, effective control the bleeding, everything is there. Not to worry. Next one. And maternal mortality nil, but morbidity is still 12.76%, but not to worry for that one. Next one. Now in the special situation in the placenta increta and parcita. Next one. Diagnosed by ultrasonography. Next one. Oh, I make it placenta increta parcita in two parts, partial and complete. Next one. This is my this is I have done it for the teaching our PG student. Next one. Next one. So we find that my technique is very simple. Placenta increta and increta fundal incision given by the other people. By my intention is very clear. Doctor's techniques plus removal of the placental addition along the part of the uterine wall. That is my techniques of placenta increta and parcita. So not to worry this one. This is a partial. Means so the initial line is the increta and parcita. Other area it is a accreta. So you can remove nicely, not to worry. Next one. So incomplete invasion of the uterine wall and bladder. So my management is very simple. Either you could kept in placenta in situ with high dose antibiotic or hysterectomy. In European country, in other country, they are doing the hysterectomy. Next one. But my experience of placenta kept in situ in 7 cases is excellent one. Not to worry, no mortality, nothing is there. So I'm telling of each young generation who come from forward, not to worry for the placenta previa. So placenta previa accreta, no problem. You follow my techniques. Placenta increta and parcita also, you may divide into the partial and complete. In the partial, you do my techniques you've seen in my journal application, and also complete, you see I kept in placenta situ. Because in our situation in the well area, if we do it, if any patient die, then we cannot escape. So therefore, to escape at that time is very important for us to keep it, not to worry, give the blood transfusion or the record. Next one. So in conclusion, it's a very simple and safe, quick procedure, not to worry. easy to perform. Next one, sufficient to prevent the control. Next one, then is a suitable technique for rural-based hospital in absence of the blood transfusion or the facility, especially in case of placenta, previa ectita. But in kidney and percita, there is no problem. It kept in situ, not to be worried for this one. Next one. So this is was in Washington when I presented this paper, myself and Professor Wheelings is there. He told me that you are doing the good work, how to prevent the uterine atony, but he is doing the good work, how to cure the patients. So he is doing the curative method and doing the preventive. So he came to my place to Kalani to see my techniques, why during time of why mothers die. And I'm saying before you, he recommended my name along with our Arun Kumaram to go to the FOGSI. Next time. Next. So thank you very much giving me all the opportunity. And at the same time, I am telling the Sinamali and others for secretary, Thambi, please send the government of India regarding my techniques, because I may send to the government of India, they are giving me the good response. I am requesting from the ICOG chairman and all the members to see my techniques, whether good or bad. You decide it and send it to the government of India. My techniques already published in the journal. Already FIGO had accepted this one. It will help our women all the time, because we cannot see all the time of curative methods developed by outside the countries. Why not adopt our own people who develop the method? This is my request to you. So send the government of India my techniques of this one that I done, which is most comparably better than anyone, because my technique is a preventive. You know, normally uterine atony, it is a physiological and biochemical bleeding, lack of calcium production, everything not contracted. In the placenta BBI is anatomical bleeding. Only tie the uterine artery before taking the placenta. Why not where people are doing it? I'm training for last 10 years. But due to I don't know unknown reason, you are not sending. I request of the previous chairman also. ICOG, please send it. So thank you very much giving the good opportunity to talk on this my best subject, reducing the maternal death. Thank you very much.
So, thank you, Dr. Datta. I think we have been together, like we are following whosoever is working with you since 3 decades. And the message to all the ICOG fellows and the FOGSIan is that wherever you are, actually the main inspiration is that organizing all the clinical work and put into that they organize research, seemingly simple, that matters. And the belief in what Dr. Rohit Bhatt says, first you give experience and then you have the experiment and then you put it forward. So your journey was actually the amalgamation of Dr. Rohit Bhatt, what we say. And this is a great message. ICOG will do all the things and we will be benefiting from your all experience and hard work. The important thing that the people who are working in like diverse setting in our country, and whatever they think they can do the innovation, they can accumulate the data, and now with the all computerized and the AI, we have a better system of organizing our data, and we can put forward the better and the cost-effective means to save the mothers all over the world, because world is diverse and it is going to be more difficult in the tomorrow with all the war and turbulence. So it's not that we always have money and always the simple things but for the most and maybe the best also. So thank you, Dr. D.K. Datta. Thank you for your time.
Thank you, madam. Thank you.
Like compiling and sharing your long journey with on the Guru Mantra side.
Thank you. Thank you.
Yes, Dr. Parag.
Yeah, thank you, Dr. Datta. It is wonderful to listen to you, and Sadhna will also remember that we were the very enthusiastic governing council when you were
Yes.
the chairperson, and we've been tutored by you in our initial days. Uh, I remember vividly posting your technique on the ICOG website long ago when I was
I know,
secretary of
I
the
know it.
ICOG.
Thank
And
you very much.
because we wanted our ICOG fellows to receive this information by which is the original research done by you as a past chairperson of ICOG.
And thank you.
And so many of us are witness to your journey, and we always appreciate the kind of work that you're doing, especially in the low resource settings, and which are so relevant in our country, where still in a lot of places the resources are not that great. So do continue contributing to ICOG, and I'm sure with your help, we will be able to
Definitely.
do our bit to the maternal mortality, which in fact is the prime motto of the chairperson this year. Thank you very much.
Thank you. Thank you, Dr. Dilip Datta. I still
Yes, thank you,
remember
madam.
my visit to Kalyani, and we conducted the same PPH workshop. I think
Yes.
first day we did it for nurses. I think you said that it is very important that we have to train the people, those who are working as our great support. So we had a workshop for nurses, and then it was followed by, I think next day we had it for doctors. So
Okay.
we also had hands-on, and I still remember that workshop that we traveled from Calcutta to Kalyani, and that time I realized that your work at a grassroots level, whatever you are doing, is so relevant, and it does matter, and you still continue to do so. That is a great thing. So again, once again, my pranam to you,
No. Thank you.
both the gurus today, Sir Rohit Bhatt as well as Dr. Dilip Datta. Thank you.
We
Sarita is
have with us
our-
Dr. Sarita Valera, our Vice Chair-elect of ICOG, requesting her to please speak.
Hello, at the outset, let me congratulate Dr. Sheila Mane and Dr. Pratik for continuing this wonderful program of Guru Mantra. I've been part of it for 2 years. This is the third year going on, and I think it's an excellent program. It's wonderful to see Sir Dr. Rohit Bhatt and Sir Dr. Datta on this program. It's really wonderful, and I enjoyed your videos, sir. They were very nice on PPH, and I really think this program is going very well. Thank you.
Thank you. How is madam?
Thank you, Dr.
She's
Sarita.
fine, sir. Thank you so
Okay,
much.
thank you. Give my pranam to her.
So I think we've had two fantastic lectures by two legendary stalwarts of FOGSI and ICOG. It's really been a privilege to witness them, and I can say from a young age, I've actually watched both these stalwarts. It's hard to think of me as a young man once upon a time, but since the last 20 years, I have actually been watching them, listening to them, learning from them. And as I said a little while earlier, I hope that we as students can carry on their legacy, can imbibe their teachings, and hopefully we will also be able to pass them on to our juniors and the generations to come. Because these are teachings which come to us from stalwarts and gurus. In India, we have this Guru Shishya Parampara which has been there since millennia. With the advent of modern science, AI, internet, all these old teachings are gradually sort of fading away into the background, and we are getting more and more westernized. So this is the importance of having these legendary stalwarts, learning from them, listening to them, and taking every possible opportunity to learn from them. Because at this age also, they're so sharp, they're so intelligent, so precise. Dr. Rohit Bhatt's sense of humor is something which will stay with you. If you listen to him once, it's something which will stay with you for a lifetime. And even now at this age, he's so sharp, so witty, so intelligent. It's lovely to listen to both of them. Uh, if anybody else wishes to speak, our GCMs are here. Please feel free to unmute and speak. Otherwise, we can go ahead
Recordings
and
are
proceed with the
available. Those who missed it,
vote of thanks.
recording will be available on the website. Okay. I think after a week, I think everybody will be able to. Somebody has asked in the chat box whether there will be a recording. So just
Thank you.
yeah, reply to that. So Once again, I take this opportunity to invite all of you to Bangalore for ICOG annual conference on 21st, 22nd, and 23rd of August. You can visit the ICOG website. You will get all the details. Okay, so it is fertility and beyond, and all are welcome to Bangalore. Thank you.
Thank you.
And
Thank
those
you,
of
madam.
you who have not applied for the fellowship so far or the membership of ICOG and who are here in the audience, the portal is open until 15th of July. All of you, please apply. The criteria are very clearly mentioned on the website. The ICOG office staff is there to help you in case of any queries. Please apply and you can receive your fellowship at the ICOG convocation in Bangalore on Saturday, 22nd of August.
Thank you.
Thank you. Thank you.
So to end the program, I'll just present the formal vote of thanks. If there is nothing further to be said, I'd like to express my gratitude to the FOGSI and the ICOG office bearers, our president, Dr. Bhaskar Pal, chairperson of ICOG, Dr. Sheila Mane, the other office bearers of ICOG, Dr. Ashok Kumar, who's our chairperson elect, Dr. Sadhana Gupta is here herself as the vice chair of ICOG. She was the chairperson, and Dr. Suvarna Kadilkar, who could not join us, Secretary General of FOGSI. We had two legendary speakers, Dr. Rohit Bhatt and Dr. Dilip Kumar Datta, who graced the occasion and shared their teachings and their knowledge, which they had gathered over so many decades. And as I said, it was fantastic to listen to them and learn from them. Thank you, everybody in the audience who joined. Thank you, our backend team, who is comprising of Nilima and Poonam, our ICOG office staff, who work very silently and diligently behind the scenes. Thank you, Shreya, and the internet host team
Thank
as well
you,
for
Dr.
all your
Parag.
hard work.
Last moment,
And
Pratik. Parag Beniwale accepting our invitation to chair the session. And I think Parag, it
I
was
was
really
going to save that for
to
last.
have you. Yeah. I think you are.
Thank you,
Sheila,
Parag, for being there.
It was
Thank you
my
for guiding
privilege
us.
because Dr. Rohit Bhatt is my all-time favorite. So getting to introduce him was something I always looked forward to.
Yeah.
Thank you.
Thank you.
Thank you all. Yeah.
Hello, thank you. Bye-bye.
Thank you, Sadhana.